Midwest Children's Resource Center is probably the base organization in the kind of three programs that we've been talking about today. And MCRC has really been part of children's for a long time, founded in the 1986 by Dr. Carolyn Levitt. CHA has been really on the front and supporting all of them right from the point of conception. So a lot of our work is really providing healthcare to kids. And so that often involves maybe doing a videotaped interview with the child and doing examinations of their body. With parents, we're doing anticipatory guidance. We're thinking about other issues that might need to be dealt with that are going to require referral. But we're also coordinating with those other agencies that are involved, be that child protection, law enforcement, any of the legal professionals, to try to make sure that we're trying to minimize the trauma that child is experiencing so that they don't have to bounce from place to place to place, and we can coordinate services all in one location. If you spin back to the 1980s and even before that into the 70s, people weren't really thinking much about child maltreatment, right? We kind of had this thought that it really kind of doesn't exist. It's not really a thing. And it certainly wasn't typically thought of as a health care issue. And really, I would say that Children's was really ahead of the ball on that by having really a dedicated focus and looking at, hey, what can we do to help kids who have been victims of maltreatment?
What happens is a youth gets referred to MCRC, and so they get referred to whatever it is they're experiencing as far as any maltreatment. And if they are deemed as a high-risk youth and need extra support, that's where they enter into the Runaway Intervention Program.
Runaway Intervention Program is a year-long program for young people who've experienced sexual assault, sexual exploitation, or other traumas. And what we do is we pair these young people who come into our program one-on-one with a nurse practitioner. And that nurse practitioner provides community-based healthcare and health education with the goal of taking a young person and ensuring they return to a healthy developmental trajectory.
A lot of what youth in our program are tackling center around trauma symptoms, having a sense of safety, feeling like they can't trust people, that their pure relationships, their familial relationships, their self-esteem, their confidence. I think part of the trust part is you have an adult in your life that you have cared about and maybe even loved, and then they sexually abuse you. And so you start to really question your worldview.
I think it's the knowledge that these kids or these young people need help. Like, they don't know that they need help. They push the people that care for them so much that they're no longer interested or wanting to help them. I think it's a matter of helping them become more knowledgeable about the risks. And by the time you've spent some time with these youth, even the hard ones that don't seem to hear what you're saying, you see like a light bulb click. You see a youth who hadn't responded to any of your outreach for months reach out and say, hey, Nikki, can I still come to group? And youth that have completed the 12 months who are successful and said, when I met, I wanted a baby. Now I don't want anything to do with the baby. I want to go to college and become independent, have the freedom to do things and not have my aunt or my guardian harassing me because I'm doing what I'm supposed to. And I want to do what I'm supposed to because I feel empowered to do so.
We see young people who have every indication that their future is going to be brighter because they've participated in runaway intervention.
The First Steps program can best be described as a supportive program for teenage parents. We are technically a child abuse prevention program. We do work with a lot of families that are at risk for having experienced trauma or having been in traumatic situations. We also work with families because of unstable housing situation or poverty. The goal is for First Steps to provide support and community resources and a lot of listening to kind of prevent some of those behaviors from happening or maybe divert or get ahead of them. I would love to thank CHA and all the guilds and all of the individuals in all the guilds that have worked with us over the years and will continue to work with us. I often say we're a listening program, and CHA definitely listens to what we need, and they have been there for us in multiple ways throughout the years.
We see young people who really get that chance to go back to being a kid. They get a chance to go back to going to school, playing for the basketball team, having their first job at a fast food restaurant, and just learning all those small steps towards being a young adult.
We also build the future, responsible, safe adults that have overcome life's anxieties and adversities to make success for themselves. And families have told me this program is awesome. And so hearing that just helps me understand how grateful that I am. There are people out there that are willing and available to support our service.
I'm really grateful for CHA because of I was the first therapist in this program, and because of you guys' support, I've been able to work with and help hundreds, if not 1,000 kids over the last 13 years, and doing group therapy before that. Without your support, many of those youth would have not gotten services because we're not working with youth that end up showing up in traditional therapy offices or medical clinics. So thank you so very much.
I want to thank CHA. I always say that none of our programs would exist without CHA. They have stuck with us and have been a partner with us through this entire journey. Those needs don't go away, and we need that base to be able to do the work.